Hi there. Today we're talking about a really interesting topic that a lot of us have maybe experienced or have talked about with someone who's experienced it. My name is Becky. I'm a naturopathic doctor, a cancer coach, a cancer thriver of over 20 years, and a mom of 3 girls. And today we're actually discussing cancer-related fatigue. And if you have ever experienced it, you're tired when you wake up, you're tired after completing some light chores, or you hit that after lunch dive and it just does not get better for you. And this not only limits your day-to-day activity, but also the number of things that you feel like you can do and the number of times that you feel like you can spend doing the things that you love, or especially with your loved ones. And that really can impact your life because maybe they've told you it's normal to feel this way, like you just need to peel yourself off the floor. They say it's common, just accept it. And you start to think that with time it'll actually get better. But maybe it's been months or maybe years where it hasn't gotten better. Or in fact, for some, maybe it feels as though it's gotten worse. But the thing of it is that actually time or waiting for it to get better is really not the thing that's going to help it. So again, I repeat, waiting it out is not the thing that will help it. And if you feel like you're the only one experiencing this, you're actually not. Research shows us that at least 30% of cancer survivors experience persistent fatigue for months or years after a cancer diagnosis. That's years after a cancer diagnosis. But the great thing is you don't have to be part of that statistic. And the faster you work on getting at the root of cause of what's causing your fatigue or making it worse, the more you can start impacting how you feel, your energy levels, and get back to doing the things that you've been wanting to do. But just a clarification, for any cancer survivors that have felt this, or maybe you've had a loved one who's experienced this and has shared this with you, cancer-related fatigue is not like normal fatigue. It just isn't. Cancer-related fatigue is actually tends to be more severe and longer lasting. And the interesting part about cancer-related fatigue is that it doesn't actually get better with rest or with sleep, which is very different from our normal fatigue that we all know and we all experience. The thing is too that it can affect our daily routines, our activities, our relationships, social events, and just our quality of life. In some cases, this can even lead to mental fatigue and mood changes as well, and you might have experienced that too. But to understand better what we can do to help improve this type of fatigue, because yes, there's still hope. And there's hope in understanding exactly what the underlying causes are so that we can start impacting those things to improve that energy level. So here are some underlying things that may be causing that fatigue. The first thing is actually medications. So when we think about medications, we're not necessarily thinking about the medications that we took for cancer, but things like antihistamines, antidepressants, pain medications, all of those types of medications can actually cause fatigue or make fatigue worse. The second thing that may be causing or worsening our fatigue is actually things like our anemia. So you may be diagnosed with anemia, and that really means that you have a lower number of red blood cells than normal, which can be caused by low levels of B12, iron, or folic acid, which could be impacted by the fact that you're just not absorbing it efficiently, or your diet just doesn't have a lot of it, or maybe it was due because of a side effect of one of the treatments that you got for cancer. The third thing that may be causing it is actually pain. So this could be something that resulted from the cancer itself, or maybe treatments to deal with the cancer. Infection is another one. Whether people are getting a viral infection like a cold or flu, this can also increase that fatigue as your body is trying to fight it off and make it worse. Emotional distress. So we're talking about anxiety, depression. And did you know that about 15 to 25% of cancer patients actually get depressed? I would like to think it's a little bit more than that, to be honest. Not that I like it, but I've seen it so much. And I would also like to say that 100% of us cancer survivors have experienced some anxiety at some point, whether it's that anxiety of being diagnosed or of waiting for results, or the uncertainty of treatments, the outcomes, the fear of side effects from those treatments, how this affects our relationships and our families and our jobs. There's so many things that we could potentially be anxious about. And so this can also feed our fatigue, as that mental distress we know really affects how tired or how energetic we feel. Cognitive issues like brain fog also may cause things to worsen, because people often get really distressed when they can't remember details that they used to remember. We'll be talking in depth about brain fog in a later episode, but it can feel as though your brain is taking a little bit of a vacation somewhere and you just don't feel exactly like yourself yet. As you're trying to move forward in your life, it can be very distressing for people. Stress is another one that can potentially worsen the fatigue. So much stress from getting diagnosed to having your life turned around. And this is one that is a real struggle for many cancer survivors during treatment, post-treatment. There are so many different reasons that bring stress to our lives, whether it's relationships, jobs, and so much more can really bring on that stress. Sleep issues. Quantity and quality of sleep are super important. So not getting enough sleep, but also not getting enough of that deep restorative sleep is really critical in terms of the way that we feel and the amount of energy that we also have. And this may also be due to different hormonal imbalances that need to be addressed. And of course, that mental physical connection, right? We can't sleep if we're stressed out all the time as well. Chronic inflammation, we talk about this a lot as well, but this can also cause our energy levels to go down. Nutritional deficiencies or poor nutrition in general, so maybe we're not absorbing the foods that we need to absorb well, or maybe we're just not eating enough. Dehydration. Our bodies are made of 60% water and our brains have 75% water. And so you can just imagine how important being hydrated all day long can actually be to impact also our energy and other pathways as well. Being less active. So you think, man, I can't exercise right now. I'm feeling so tired. But research actually shows that exercise may actually be beneficial in order to combat that cancer-related fatigue. So doing too little can impact and increase that fatigue. Weight or muscle loss can also be due to decreased appetite, and that can also, again, increase that fatigue and make it worse. Excessive weight gain. And this can happen actually after treatments. I think a lot of us think that most of us just lose weight after treatments, but that's not actually the case. In fact, a lot of us gain more weight, and that can affect our fatigue levels. Suboptimal hormone levels are also one thing that are super critical. We're talking about cortisol, our stress hormones, our thyroid hormones, and other hormones that can really worsen our feeling of energy, essentially. Because the reality also is that the treatments and everything that we've been put through has impacted our bodies in some way, and those hormones are going to be impacted as well. So for example, studies have shown that thyroids can actually be affected during certain cancer treatments, which then cause more issues that are like hypothyroid symptoms. So that fatigue, maybe hair loss, maybe just, difficulty sleeping. It's not because we have an actual thyroid disease, but it's just because the levels are not in the optimal range that we want them to be at. And that's so critical also for allowing us to be in our healthy weight. And that can be a thing for a lot of different hormones, not just necessarily the thyroid hormones, but that multiple different types of hormones can be affected. And also as well, other underlying medical conditions. Maybe it's things that we've had before the cancer itself. Maybe it's things that happened as a result of the cancer or the cancer treatments. But all those things in totality can actually be some of the causes of why we're feeling so tired, and we feel tired often. And so it's super important that we get to that underlying cause of why we're feeling fatigued in order to start improving things. And the great part of it is that this whole systems approach of really dealing with everything in totality can help us to get back to where we used to be or closer to it day by day. The next time I'll be talking to you about some strategies around helping to ease up that fatigue. So I hope you like this episode. Please share, save, and subscribe to this channel as well. And we'll see you soon.